Oh, okay. So we were talking about the depression scenario. It was almost finished. Okay. One thing regarding follow-ups we can discuss. Okay, let's wait for few people to join. Okay. So we were talking about follow-ups. Okay. So this patient was having age of 31. If the age is less than 30, follow-up is in 5 weeks. And if the age is above 30, then the follow-up is in 2 weeks' time. Okay. And also in the management part, when you guys use the word of psychotherapy, try to explain the meaning of psychotherapy to the patient, that you know what psychotherapy is going to do for you. Okay. So is there anyone who can explain what is psychotherapy? How you're going to explain about psychotherapy to the patient? So for psychotherapy, explain that this is a problem focused therapy. And Jenna, in your case, you have suffered a loss and you have been feeling really, really low. So once you're going to talk about these feelings about the loss that you have suffered to a therapist, we are going to explore these feelings and then we are going to provide you with the tools to overcome these feelings. Okay. So the whatever, like, if there is a relationship issue, then tell her that, you are going to talk about your problems, relationship issues, your self esteem, how this has affected you with your therapist. And the therapist is going to provide you with the tools, with the information that how you can deal with this. And this not only going to improve your mood, but also your self esteem. And once your mood is improved, your self esteem is back, your tiredness will also go away. Okay, because your tiredness is because of your low mood. Okay, so this is the symptomatic treatment that you have explained patient really well, that your tiredness is because of your low mood and your low mood is because of your brother's passing away. And once you're going to talk about all of these things to the therapist, everything will be okay. This is for all the Plab 2 scenarios, like whatever is the presenting complaint of the patient, take that, mention that thing in the management part and manage that specific thing and explain that thing to the patient. Okay. And this is going to give you marks in the IPS, that you have explained really well to the patient. And next you can give the lifestyle advices and talk about this to your friends and family and all those things. Okay. And if it is a moderate depression, then don't forget to talk about crisis helpline card. Okay. And then tell the patient that, it is okay to feel low and overwhelmed sometimes. All we need is someone to listen to us. So, and so that you don't feel out of character. So if you ever feel like that, if you ever feel alone, then always give us a call. Okay. And I'm going to provide you this card and we are here for your help 24/7. Okay. So explain crisis helpline card as well. Explain psychotherapy, explain crisis helpline card. That what is the purpose of this, when you are going to use this card. Okay. And don't offer crisis helpline card in my mild depression. It is for moderate and severe depression. Okay. So, yeah. Any question regarding depression scenarios now? You can also give multivitamins to her for tiredness. Okay. If she insists on, or if her concern is that, can you give me the sleeping pill or some medicine to improve my mood, then counsel her that, medicines are not the way to go about it. First, try these things and I can give you some multivitamins. Okay. Okay. Should we move on to the next scenario? And is there anyone who wants to do the other scenario? Anyone who wants to participate? Farheen and Ifra and Rana, and we have Samina Khalid.
Yes, I can try, Dr. Fazil.
Okay. The other doctor was Imtiaz. She's not back yet. She did the scenario. Okay. So, when is your exam?
My exam is in last week of June, doctor.
What? When?
Last week of June.
Last week of June. Okay.
Right.
So, okay. Let me share STEM.
Okay.
Okay. I have shared the STEM. Think about it. I will be back in a minute and then we will start. Okay. Okay. Are you ready?
Yes, doctor.
Okay. Enter the cubicle.
Hello, examiner. My name is Dr. Rana. My GNC number is 1234. May I proceed?
Yes, doctor.
Thank you. Hello,
Hello.
I'm Dr. Rana, one of the doctors working in the CP practice. Are you Malinda Smith?
Yes, doctor.
Okay. Could you please confirm your age for me?
I'm 32 years old.
Thank you. What would you like me to call you?
You can call me Malinda.
Nice to meet you, Malinda. Malinda, how can I help you today?
Doctor, I have been having issues with my sleep.
Oh, I'm really difficult to hear about that, Maninda. Could you please tell me exactly what do you mean by that? Do you have like difficulty falling asleep, or do you wake up in the middle of the night, cannot fall asleep, or do you wake up early in the morning?
Doctor, I'm not able to fall asleep.
Right. Okay. So how much time normally does it take to fall asleep?
3 4 hours.
4 hours. I see. Okay. So basically, how many hours do you sleep in a night, Melinda?
It's different every night, actually. Sometimes I just
Uh-huh.
sleep for like 2 3 hours and then I wake up again. And sometimes I get four
Mm-hmm.
hours of sleep, and sometimes I'm not able to sleep at all.
I'm
I
really
feel
sorry
like
to hear
that
about
it's
that.
been ages now that I have had any good sleep.
Mm-hmm. May I know, like, since when you're having this kind of problem?
For the last 4 months.
4 months now, I see. Okay. So, Melinda, do you think that was it triggered by anything at all?
I have no idea, doctor.
You don't have any idea. Okay. Do you have any other symptoms apart from this?
No, doctor, it's just a sleep issue.
All the sleep is okay. Do you do any specific activities before going to the bed? For example, drinking coffee, tea, or maybe watching TV late at night?
No, doctor.
Right. Okay. So if you drink any alcohol, do you drink any alcohol before going to the bed by any chance?
No, doctor, I don't drink.
Okay, that's all right. Okay. So apart from that, how is your mood, by the way, Melinda?
Mood is low.
Low. Okay. So on a scale of one being really low and 10 being the happiest, how much would you like to score for it?
It's maybe 3 or 4.
Right. Yeah, it is really low, Melinda. Okay. So, Melinda, during the last month, have you been bothered by feeling depressed, down, or hopeless?
Yeah, doctor, I feel really hopeless.
I see. Okay. So, as well as do you bother by feeling, bothered by losing interest in the activities that you used to enjoy in the past as well?
Yes, doctor.
Right. Okay. So, how is your concentration level, Malinda, in the daytime?
Not good. I
Not
always
good,
feel
right?
lost.
Okay. So, how is your appetite? Are you eating well?
Yeah,
Okay, that's good. So, have you noticed any recent changes in your weight by any chance?
no, doctor.
No. Okay. So, apart from that, how is your energy level? Do you feel tired all the time?
Yes, doctor, I feel tired.
I see. Okay, Melinda, may I ask you, some might think, some people might have this kind of difficulty sleeping. Sometimes, if there is something significant happened in their life. So, has anything happened recently in your life?
No, doctor.
No, okay, no worries. So, other than this, have you been feeling any physical symptoms? For example, feeling warm when other people feels normal, or feeling heart beating?
No, doctor.
No, okay. So, Melinda, apart from this, uh, sometimes people feel like when there is very low mood, sometimes they think like harming themselves as well. So, has this ever been the case with you?
No, doctor.
No, okay, all right. So apart from that, Malinda, I understand that this has been going on for a month now, for quite a few months now. So, how are you coping with that? In terms of like, have you ever tried to cope with your family and friends, or have you ever tried to do that?
No, doctor.
No, okay. So sometimes people cope up with these sleeping problems by using some kind of like smoking, alcohol, or sometimes they prefer to take recreational drugs as well. Has this ever been the case with you?
No, doctor.
Okay, how is your recent health been, Melinda, apart from this?
It's just that I feel
Just
really
that.
low.
Okay, so any medical condition been diagnosed before, Melinda?
No, doctor.
Okay, are you taking any medications on a regular basis?
No.
No, okay. Thank you very much for answering all my questions. Melinda, I understand that this must have been very difficult for you at this point. What do you think might be the cause of your symptoms, Melinda?
I have no idea, doctor. If you can give some antidepressants, that is going to be really, really helpful for me.
Okay, we'll talk about that, Melinda, in a bit later time. So, are you worried about anything apart from these sleeping problems, Melinda?
No, doctor.
Okay, so Melinda, let me quickly examine you if that's okay with you. I like to take your blood pressures, heart rate, temperatures, and then I like to take your body mass index. That means taking your weight and height ratio. Would that be okay?
Yes, everything is normal.
Okay, thank you. So, Melinda, from the information I gathered, it seems like you might have a condition called depressions. Have you heard about that?
What, doctor?
Depression. Have you heard about that?
No, doctor.
Okay, so it means like, depressions means sometimes, people feel constantly low or have constant low mood, or sometimes they have problem with sleeping as well. Might be one of the reasons. And when it started impacting someone's life significantly, like you mentioned to me, then we call this as a clinical depressions, Melinda. But you don't need to feel worry at the moment. There are a lot of help available for you. So, do you want me to talk through that?
Yes, doctor. Okay, so we will end the scenario here. Your time is up.
Okay. Thank you.
Okay. So,
Thank you.
yeah. So basically, you missed one thing. Again, causes. I have just mentioned, and you don't know the
Oh,
cause of
yes.
depression. So it was relationship issue and it was domestic abuse.
What
Okay. So
was the domicile? Right.
see like how important it is, the heading of hallmark causes, which I have discussed previously. Okay.
Right.
So
Right. Yeah.
when you explored really well, like the minor symptoms, the major symptoms, you have explored about the sleeping problem as well, which was good. You were doing good, but you skipped the third step, causes. Okay. So and she didn't mention, she is not going to open up there. So again, have you lost anyone recently, and who do you live with, how is your relationship with your partner? And here she is going to be a bit reluctant, and then you are going to get an idea that there is some problem here, and she is not going to make an eye contact, and then you will know that
Mm-hmm.
it's domestic. Now you're getting my point. Okay, so causes are
Yes.
very,
Yes.
very
Yes.
important. Don't miss them. Again, I will revise that. First step is minor symptoms, then major symptoms. Like if she is presenting with the sleep problem, then all those sleep questions which are written everywhere, which you have explored really well, like trouble falling asleep, staying asleep, at what time do you go to bed, at what time do you fall asleep, and when was the last time you slept at all. Okay, if she's awake for more than 72 hours, then you might have to give the sleeping pill. Okay. And what keeps you awake? This is the triggering question. Okay. Sometimes they will
Mm-hmm.
tell they keep on thinking. So that will also give you an idea that what's going on in their life. Okay. So sleep problem, major, minor symptoms, really quickly. Like these questions should be on your fingertips. Ask them quickly. Okay. So keep on exploring, exploring, and exploring. And then causes, like, then you will be like, okay, let's suppose she doesn't open up. You ask like, okay, your relationship issue. She's like, no, I have no problems with my partner, but she is not going to make an eye contact here. So then you are going to signpost that, Melinda, you came here with low mood and some sleeping problems, and on top of that you have not been able to concentrate on your day to day activities, like whatever the symptoms she tells you positive, just summarize them and say that I'm a bit concerned about you, because I believe that all of these symptoms are connected to something else. Okay, and there is something more to this, and I'm here to help you, Melinda. Take her name, build a rapport with her. Okay, so this is a safe space, and I will try my best to help you out. So I'm really, really concerned about you. So please tell me like what's going on. Okay. So in books, they have written like, again and again, keep on signposting that, this is a safe space, this is a safe space, and nothing more than this. In order to explain her in a better way, summarize her findings. Okay, and tell her that why you are concerned about her. There are so many things happening in your life, and you have been affected so much, so I believe there is something more to this, and I want to help you. I'm here to help you. Okay, and this is a safe space for you. So please share like what's going on. Then she will say that, my husband beats me up. Okay. So then
Mm-hmm.
comes the victim history and the abuser history as well. Okay, so now we have covered first step, minor symptoms, major symptoms, a sleep issue, hallmark, causes. Then we signposted that there is something more to this, and then now we know that there is an abuser. So abuser history, next heading should be okay. So and don't spend much time. Once you have an idea this is domestic abuse, you know that this is going to be a long history. Okay, so just say one or two lines. I'm really sorry, Melinda,
Mm-hmm.
you have been going through this. For how long this has been going on? Immediately, like your next question should be there. Okay, so what people do is they're just like talking and talking and providing support for like 2 minutes. Okay, so just say I'm really sorry about this, and for how long this has been going on. Okay, And the next question, okay, so why do you think he does that? Has he ever tried to force himself upon you? Question after question, okay. So there are grades of abuse: emotional abuse, and verbal abuse, physical abuse, and sexual abuse. Here she is tell if she tells you that he is already beating her up, then that means he is already on the third level, physical abuse. So just ask about sexual abuse, like has he ever tried to force himself upon you, and why do you think he is doing this, and does he has any mental health problems, and is he under the influence of drugs, okay, or alcohol, okay, and has he always been like this is very important, and does he carry a weapon? Okay, so these are four to five
Yeah.
questions that you are going to ask in the abuser history. If you guys are noting it down, I can repeat for you. And in books, they have written quite a lot of things, like, what they are asking about bruises and, pushed you and this and that. That is just a story. That is not going to help you in any way in the management part. Okay, so these are, I believe, these 4 to 5 questions are the best questions to ask. Okay, beating you,
Yeah.
that means that there will be bruises and everything, that is already making sense, so there is no point of discussing those things. Okay, if she tells you something else, like, emotional abuse or something, then you can ask about, like, you can ask about the physical abuse. Okay, so it depends like what history they are giving you. Okay, so don't depend on scripts. Main thing is this. Okay, so yeah, abuser history, 5 questions, these, and then comes the victim history. Okay, so what you have done, Jenna, for this? Okay, like what have you done so far about all this? Have you tried talking about this to someone? Okay, here you will ask about, now you will ask about the coping mechanism and abusive mechanism, which again comes from the depression approach, which we have discussed already. Okay, and are you dependent on him in terms of your finances, shelter, and immigration? And what do you do for living? And are there any children at home? And how is his relationship with them? If yes, okay. So this is the history of the victim. So now again, minor
Mhm.
symptoms, major symptoms, a sleep issue, you have explored everything, then hallmark causes, then implied approach. I call it implied. You will imply on her that, you have told me all this. So that's why I'm thinking that there is something more to it. And then she will open up, and then comes abuser history, and then comes the victim history. And in victim history, again, I will repeat that. What have you done so far regarding all of this? Are you dependent on him in terms of your finances, shelter, and immigration? Again, ask in one line to save your time. Okay. And what do you do? And like, this is also going to give you an idea that, she is dependent on him financially, and children. Okay, so next, again, coping mechanism. And there you asked me about friends and family, which was good, but again you missed another question which I told. What has prevented you to do so? I told you though that I haven't talked about my low mood and anything about
Mhm.
this with my friends and family. If you have asked me what has prevented you, I might have told you that, because like my partner doesn't allow me. Okay, so from there
Mhm.
you will get an idea that where this is going, but again you skipped the question there, you didn't explore. Okay, so see, like, this is concerning thing, that she is not talking to her friends and family. Whenever we have a problem in life, what is the first thing that we do? We talk about that with our friend or someone from the family. Okay, but if someone is not talking, then you need to know the reason that why she wasn't able to open up in front of them. Okay, so this question is also very important: what has prevented you? Okay, so see, like, every question is important. That can the answer to any question can lead to towards the diagnosis. Okay, so main thing is that, explore, like, if you find anything in the history, just don't skip that, just don't ignore that answer of the patient. And yeah, then again, previous medical, after smoking, alcohol, abusive mechanism, previous medical conditions, allergies, and any other concerns. Okay, so now you know that how you are going to do this. I have selected these two scenarios so that you can get an idea that how you are going to correlate insomnia scenarios, domestic scenarios, and depression scenarios. Now all of them have the same approach and you will reach your diagnosis. Okay, so next again, examination part, observations and general physical examination. There they can give you the finding of bruises or something, or they might not give you. Okay. So yeah. And then thank the patient for opening up. So I call it tech approach. Thank the patient in order to remember this, that thank the patient, show the empathy and condemn domestic abuse. Tech approach. Okay, in order to remember that you have to do these three things in the management part. As I have told you that in while doing data gathering, you just said I'm sorry to hear about this, that you're going through this, right? And you just moved on. Now in the management parts, first you will say thank you so much, Melinda, for talking about this to me. I know this was not easy for you, but let me tell you that this is totally unacceptable. You have to act like really serious, and your tone should be like this, that you know this is totally unacceptable. Your body language is going to matter in this scenario. Okay, and I'm so sorry, empathy. Now we have thanked the patient for opening up because she wasn't willing at all to share this personal information. Okay, so now show after thanking the patient, you have to show empathy, that I'm so sorry that you have to go through all of this. And this is domestic abuse, and this is totally unacceptable, especially in the UK. And you have the rights, and this can all go away right now and here. Okay. And we will provide you with everything, whether you need help with the shelter, finances, or anything. We are here to help you. Support as well. Thank the patient, show empathy, condemn this act. Okay, this is against the law and it has severe penalty. Okay, this is illegal. And then, provide support that, okay, whatever you need help with, whether shelter or finances, anything, don't worry about that. Even we can help you with the immigration. Okay, but the choice is yours, that like what you want. Okay, so if she says that, doctor, I want to go back to him, or I want to go home now, then talk about this question comes here. Okay, so do you have your important documents with you? Okay, and in case things go from bad to worse, do you have any escape plan? Okay, so like usually people ask these questions while they're gathering the data, but I adjust these questions in the management part. Okay, when she is going to tell you that, I want to go back. Okay, so if you want to go back, do you have an escape plan? Because things are going to be really bad, it can happen something bad again with you. So do you have an escape plan, and do you have an access to the telephone line? Do you have your important documents with you? Yes or no, then depends that what she is going to answer there. Okay, and then comes the symptomatic management, that low mood and sleeping problem. We are going to arrange psychotherapy, and again the same symptoms, for your these symptoms, psychotherapist is going to talk to you. He is going to provide you the problem focused therapy. And once you're going to talk about your problems, your mood is going to improve, your self esteem is going to be back, and you're not going to feel tired and blah blah blah, like whatever she tells that she has problems. So address them, symptomatic management. Okay, for pills, okay, so tell her that pills are not the go way to go about this. And first we will try these things, and then involve social services. Okay, they are going to talk to your husband and your partner, and will tell him that there are people out there looking after you, looking for you, and he cannot do this to you. Okay, and then domestic abuse helpline, talk about that and tell her that, if you feel that there is any danger, just call 999 or dial 55 if you can't speak or anything like that. Okay, and we will arrange a follow up for you in weeks time to see how you are doing. Okay, so
Okay, doctor. Thank you very much.
so this is how you're going to do the domestic abuse. Any questions?
From my side, I don't have any questions. Thank you.
Okay. Okay. So, guys, I will end the meeting here. Thank you so much for joining, and please leave a review in the group. That is going to be helpful for me.
Excuse me, Dr.
Yeah,
Mariam.
yeah.
Please, can you please repeat the victim side questions? What you were?
Okay. So, for victim, you will ask, what have you done so far about all this? Okay.
What have?
And
Right.
are you dependent on him in terms of your finances, shelter, and immigration?
All right. All right.
Okay.
And please repeat the abuser.
And ask about
The,
children as well in the victim history. Are there any children at home, and how is his relationship with them?
right.
Okay, if there are.
Right. All right. Thank you. No, and the please the abuser sides questions as well,
Yes.
please.
So for that, you will ask how long this has been going on. Okay.
Yeah. Thank. Yeah.
And
Right.
has he ever tried to force himself upon you? Or like,
Right.
has he ever tried to assault you sexually? Ask in any way.
Mm-hmm.
And
Mm-hmm.
why do you think he does that? Why do you think like
Right.
he's doing this? And yeah, does he has any mental health problems?
Oh, right. Yeah. Actually, I was forgetting this. Yeah. Thank you.
And
Why do
is
you?
he under the influence of any alcohol or drugs? And has he always been like this?
Right. Thank you. Thank you so much.
And does he
That
carry
was.
a weapon with him? This is also important.
Yeah. Thank you.
Okay, no worries. Okay.
Thank
Okay,
you so
thank
much.
you.
That was really nice. Thank you.
Thank you so much, guys. And if you want to join personal mock sessions, do let me know in a chat, separate chat. Okay. I do offer 5 days, 10 days, 15 days, and 20 days mock session in which I teach different approaches to the students how to correlate all like just like I have taught
Thank
depression,
you.
insomnia, and domestic abuse together. So this helps you guys really well in the exam. Okay, so good data gathering leads to good management and IPS as well. So your data gathering should be really really good. Focus on that. Okay. So
Can I
thank you.
request you, please? Can I request you, please, do it more frequently so I can, and if by any chance you could do that a bit in late evenings, like after 8 UK time, is it possible?
I
Uh,
can do that. Next time I can arrange a session a bit late. But like I'm also preparing for an exam and then I'm working and then I
sure.
have to take private mock sessions as well, like for 4 hours daily. Like it depends if I have two, three candidates per day. So it
Mm-hmm.
becomes very hectic. Like yesterday, someone's private session ended and I have arranged another mock session. Okay. So
Right.
it's like that.
Right.
So as soon as I get time, I am doing free sessions and I will try to do more sessions. Okay.
All right. Right. Thank you so much. Thank you. Thank you
Sure.
so much, Mariam. Jazakallah khair.
Okay. Bye bye. I'm just going to end the meeting now. Okay.